In this video, guys, we're going to go through the 5 phases of ACL rehab, and we're going to go through the key markers in each phase that you need to be able to hit to move on to the following phase so that you can maximize your rehab and get better faster. Okay, so you've had an ACL injury or you're a physio and you're treating someone with an ACL injury. So what's the first thing that you should do? I know this well because I injured my ACL a few years ago. It's pretty horrific. So first thing we just need to do with an ACL injury immediately after injury is just let the knee settle down. So we need to help reduce the swelling, and we need to confirm that it is actually an ACL injury. So you want to seek help from a medical professional. This way you can actually be assessed to see whether an ACL injury is what you've got. If you have an MRI scan on the knee, then that will mean that you can work out if the ACL is torn, if it's partially torn, and whether you will or won't need a reconstruction. So the question then is, should you have an ACL surgery? So I think you need to ask yourself if you can compete at the level of sport that you want to going forwards. So some people can cope without an ACL and some people can't. And it really comes down to you as an individual and how you do with your prehab, which we'll talk about in a second. If you anticipate that you're not going to be able to play sports at that high level again, I think you're going to have that ACL done. If you can cope with cutting, with turning, with those sorts of things, and it's not giving way, then you maybe could be one of the people that does well without it. But if you are getting giving way, etc., you just need to have that ACL operation done. The other thing people always talk about is what about arthritis? There's been a few studies really now that show that actually as soon as you have the injury, you are more at risk of having arthritis. And so I don't think it really should be something that you massively worry about. Worry more about the function of getting back to your sports. The other thing is which surgery to have. So we know we can have the patellar tendon graft or the hamstring graft. I had the hamstring one when I had mine done. From the research, what we can see is that patellar tendon grafts have a significantly lower rate of graft failure, which is obviously awesome, but they resulted in better static knee stability and patient satisfaction scores. So that's obviously a big plus for that. The other side of the coin though with that is that they had more rate of anterior knee pain. So that's just something you've got to bear in mind if you have that operation. The other thing to mention is that likely that your surgeon will have a personal preference and one that they do more of. So it's a good idea to speak to them, find out what they do. Just like anyone else, surgeons are going to be more skilled at something they do more frequently. So if your surgeon is always performing one of these 2 operations, I probably would say it'd be better to go with that one. Again, obviously take advice from your surgeon. So if we move on to the pre-surgery phase now. So with pre-surgery, our 3 most important goals are to eliminate swelling, restore full range of movement, and then regain 90% of strength in the quads and hamstrings compared to the other side. So how we're going to test these things is with passive knee extension to 0 degrees and knee flexion to 125, and just using a goniometer to measure that. Swelling wise, we're going to use the stroke test, where you just stroke down the knee. Again, all the videos should be on the screen so you can see these different types of tests, and then you're going to measure that. And then from strength, we're going to use a handheld dynamometer. Basically with quads, you're sitting with your hips and knees flexed at 90. The dynamometer is placed on the front portion of the shin, just above the ankle joint. For hamstrings, you're in seated position again, and the dynamometer is placed on the back of the foot, back of the leg by the ankle, just above the ankle joint. And then you're looking at strength and then comparing that from one side to the other. So it's an isometric test. So you just push against it. Again, you can see this from the video shown. And then a single leg hop test. We want to stand on one leg and hop as far as you can. You're going to measure from the toe of the starting position to the heel when you've landed. And then we're going to compare that to the other side. And we're looking for 95% as good as your good side. So you have the surgery done, and then we want to look at post-op surgery phase 1. So this is just recovery from the surgery. So our 3 main goals of this part of the post-op rehab is to get full extension of the knee. Really, really key to get that full extension of the knee so the quads can start activating, and to get the swelling down to being mild and encourage activation of those quads. So we're going to ensure that we've got passive knee extension of 0 and 125 degrees of flexion. We're going to make sure we've got minimal swelling in the knee, and we're going to look at the quads lag test to look at our quad activation. So with the patient or with yourself sitting on the edge of the bed, you're basically going to be taken into a full passive knee extension, and then you're going to be asked to maintain that when the support is removed. And then if there's a lag of over 5 degrees, that would be something that would be a positive test that just show that there's not that good knee activation at that stage. One word of warning with ACL rehab, we want to make sure that we use pain and swelling as a guide, and this goes for phase 1 and it goes for phase 2 and then through all the phases. So basically, if the pain and swelling is getting worse at any stage, you need to use that as a sign that you're not tolerating what you're doing well, and therefore either back off on the exercises. If it's really not getting that full extension, or if there's a real stiffening of the joint, then you want to make sure that you're not getting arthroplasty of the joint. So again, you would go back to the surgeon if you're really worried about any of those things. And then we're going to move on to post-op surgery phase 2. So this is our strength and neuromuscular control phase. So with all these phases, there's going to be markers for how to get to the next phase. So again, the 3 I've mentioned in the previous phase are where you would want to be before you go into phase 2. So a good lag test, minimal swelling, and extension of 0, flexion 125. So in this phase, our most important goals are to regain most of your single leg balance, to regain most of your muscle strength, and also single leg squat with good balance and alignment. So we've got quite a few markers for this one. And again, on this slide, you can see that there's this hurdle requirement. Hurdle requirement just means that you want to hit these targets before you then move on to the next phase. And this is what I love about this protocol, is that basically it's in place. So it's really simple, it's really easy. You can just use these markers as you go forwards to know whether you should be progressing onwards. So again, passive knee extension to 0, flexion to 125. And we need to use your goniometer for that, minimal swelling. So then we've got a single leg squat test. So basically standing on one leg on a 20 centimeter box with the arms crossed. And then you do 5 single leg squats performed in a slow and controlled manner at the rate of 2 seconds per squat. The task is rated as good, fair or poor. For a subject to be rated as good, so this is for a pass of the test, you would basically be able to maintain balance, perform the movement smoothly, squat to at least 60, have no trunk movement or pelvic movement, and no hip adduction or internal rotation, no knee valgus, and the center of the knee remaining over the center of the foot. Then we've got a single leg bridge test. So this is a variation where you're lying down on the floor with one heel on the box or plinth 60 centimeters high. And the knee of the test leg is slightly bent at 20 degrees and the opposite leg is bent to 90. The hip and knee flexion, with the arms crossed over your chest. Then you elevate the hips as high as you possibly can, and the assessor or a physio will place the hand at that height. And then you basically repeat that single leg bridge as many times as you can, touching the assessor or the person's hand each time. And it will basically, the test stops when you can't reach that point again. And the aim for this is to get 20 over 20 reps. Then we've got calf raises, so single leg calf raises, standing on with one foot on the edge of a step and perform calf raises for a full range of motion, 1 rep every 2 seconds, and the test is stopped when you can't do a full range of motion or you slow beneath that cadence. And your aim is to get over 20 reps to move on to the next phase. The side bridge endurance test is one from McGill. Basically, you're going to lie on your exercise mat on the side with the legs extended and the top foot placed in front of the lower foot. And then you're going to lift the hips off the mat to maintain a straight line over the full body length for as long as possible. And the test ends when the hips return to the mat, so when you basically can't do any more. Over 30 seconds is what we require to move on to the following phase of rehab. Then we have our single leg squat, so basically single leg rise test. This is basically sat on a chair or a plinth with the test leg bent to 90 degrees and 10 centimeters from the edge of a chair, with the hands folded across the chest. The subject aims to stand up from the sitting position and sit down as many times as possible. So it's basically a sit to stand on one leg. And this is to be done for over 10 reps to reach that required level to move on to the next phase. In terms of balance, we're going to do a single leg stand, basically standing on one leg with the other leg raised and the arms crossed across the chest. And then someone would time you on a stopwatch how long you can maintain on one leg with eyes open and eyes closed. And we want to be able to get 43 seconds at least with eyes open and 9 seconds plus with eyes closed. So post-op surgery phase 3 is a running, agility and landings phase. So in this phase, our most important goals are to attain excellent hopping performance, technique, endurance and a distance. To progress successfully through an agility program and modified gameplay, and then also regain full strength and balance. So here again, we've got quite a few markers. I think on the screen there it says phase 2. It actually should be phase 3 markers. So we've got our single leg hop test. So this is where we're going to basically stand on one leg and hop as far forward as possible on the same leg. And then we're going to look at the average of 2 jumps, measuring from toe to heel as we did before. And then that's going to be equal to or greater than the pre-op distance. Then we've got our triple hop test. This is where you're going to be required to hop forwards 3 consecutive times on one foot. So you're basically bouncing from in 3 steps, or 3 hops rather. And the total distance is measured, averaged out over 2 or 3 reps times. And then you would basically want to have over 95% of the other side. Then we have our triple crossover hop test. And this is performed on a course consisting of a 15 centimeter marking strip on the floor, which is 6 centimeters long. And you're required to hop 3 consecutive times on one foot going in a medial to lateral, so side to side direction, crossing over the strip on each hop. The total distance is measured and the average of the 2 is recorded. Basically, you measure from the toe at takeoff to the heel at landing, arms are free to swing, and 95% of the other side. So this is going forwards basically, but you're going from side to side of that line, as you can see in the video, and then you'd measure that distance. Then we've got a side hop test. So basically where you stand on your test leg with the hands behind the back and you jump from side to side between 2 parallel strips of tape, placed 40 centimeters apart on the floor. You jump as many times as possible during 30 seconds, and the number of successful jumps performed when touching the tape is recorded, and that's again compared from one side to the other. Then we've got a single leg squat test, which is the same as we did before over from a chair basically, so standing up from a chair. We want to be able to get over 22 reps on both legs. Then we've got our dynamic balance test, which is a star excursion balance test. And the star excursion balance test is basically performed by going forwards, backwards and to the side, and backwards and inwards. And you're going to get a score for the distance of each leg as shown in the video. And then it's calculated by adding up those distances and then basically seeing whether there's a 95% distance on your operated leg as to your good leg. Then we have our dynamic Cooper and Hughes sports vestibular balance test. So basically you're going to stand on one leg with a little bit of flexion in the hip, knee and ankle, and then place your hands on your waist. In this position, what you're going to do is do side to side, a side to side assessment. So at the rate of 60 beats per minute, you'll repeatedly turn the head from side to side, 70 to 90 degrees of turn for a period of 15 seconds. And vision needs to be in line with the head position, no visual fixing. So you're not fixing, so you're basically moving your head from side to side, as you can see in the video. Then we've got an up and down. So at the rate of 60 beats per minute, you repeatedly tilt your head up and down, looking from floor to ceiling for a period of 15 seconds. And the vision needs to be in line with the head. So again, you're following that eye line. You're not fixing your eye point on anywhere. And then the required, what you need to be able to do is keep your hands on the waist for both. So this is just moving your vestibular system around to see whether you can cope with that change in the vestibular system in terms of your balance. Then we have the single leg press. And these markers here are actually not a requirement to move on to the next stage. They're actually something that we would want to see, want to have, aim for, but not necessarily need to move on to the next phase. So single leg press, looking at 1.8 times body weight, and then squat, barbell squat of 1.8 times body weight as well as the aim for this phase. So then we're going to move on to post-surgery phase 4, and this is our return to sport phase. So for this phase, basically it's return to sport. The athlete needs to be confident and comfortable to return to sport, so it's a psychological assessment of the patient as well. And then also you want to start to implement the injury prevention program, which should go on for 6 weeks at this stage, even when you've returned to sport basically. And for this, what we would use is the Melbourne Return to Sport score. So you can either ask a physio to do this for you, or you can find online, there's going to be a link in the description below. The authors recommend doing this score for 1 to 3 sessions. And the post-op phase 5 is our injury prevention phase. So this is basically that we want to include plyometric balance and endurance exercises into your routine. You want to make sure that you're doing this, performing this more than once a week, and should be performed for at least 6 weeks. And to be honest with you, for most people, you should just carry on doing it. We want to make sure that you keep your strength, flexibility, plyometrics, and your balance going forward, so that you're at the very least possible risk of injury. So 5 popular injury prevention programs that include exercises to help this are on the web. They're the Sports Metrics program, the 11+, the PEP program, the knee program, Netball Australia, the Footy First program, AFL. So it's highly recommended that athletes continue with ongoing ACL prevention program whilst they continue to play sports. So as long as they're playing sports, they want to be doing this sort of stuff. And that's it, guys. So a very quick talk through the different phases and the key markers, objective markers that you need to hit in each phase before moving on to the next one to get that rehab good. Now, I know a lot of you might be saying, okay, great, Chris, but in this video, you've just gone through the phases, you haven't gone through exercises. So in the follow-up video to this, what I'm going to do is go through each phase. There's going to be a video for each phase of the rehab with the specific exercises that you could use. Now, obviously, this is going to be context dependent on yourself or on the patient, but it's something that I think will be really useful. So check out those videos, and once they're up, I'll put the links in this video as well. So the majority of this content comes from the Melbourne ACL Rehabilitation Guide. The Rehabilitation Guide is basically a guide put together by Randall Cooper and Mick Hughes, 2 physios, very experienced in the field of ACL rehab. And I love this because it takes into account, you don't need any specific equipment, you don't need isokinetics machines. I love it from that perspective, and I love the way it's very objectively measured and all science-based. So in the video, you're going to see that a lot of the tests have got studies by them, so you can have a look at those if you want to. And it's just a really, really good way of ticking boxes and actually making sure that, are the people ready to move on to the next phase? Are they ready to go on to running agility drills, etc.? And you can use this as a way to really progress you forwards. Now, they have, I think, a website with links for the actual guide itself, which I think you can buy. So I'm going to put a link in the description. I highly recommend it. It goes through a lot of detailed information that I haven't got time to put in this video as well. And it also in there has the Melbourne sports score, return to sports score. So it's basically the full test you would do in order to get someone to take someone back to sports. So highly, highly recommend you check that out. Hopefully you enjoyed the video, guys. Please give it a like if you did. And also don't forget to subscribe if you haven't subscribed already. I look forward to seeing you in the next video. Any comments, questions about your ACL rehab or any ACL rehab related questions, whack them in the comments below. Let me know what your thoughts are on the best exercises for ACL rehab, the ones you've really found useful, and I will see you next time.